Hello, everybody. Welcome to today's webinar. My name is Liz Gallagher, and I'm a paralegal at Lyles Parker. Today's webinar is hosted by the Texas Association of Home Care and Hospice, and it is entitled Reading the Tea Leaves: What are the top 10 risks your home health agency and/or hospice will face in 2024? Today's presenters are Gunnar Jurgensen and Richard Pecore. And before I hand it off to them, I'm going to tell you a little bit about them. Gunnar Jurgensen is an associate attorney at Lyles Parker, as well as a certified medical compliance officer and a certified professional coder. And he focuses his practice on regulatory healthcare compliance matters, fraud and abuse, and reimbursement issues. And he represents clients nationwide and practices out of our Washington, D.C. office. And Richard Pecore is also an attorney with Lyles Parker, and he has over 30 years of experience in healthcare law. And he also focuses his practice on Medicare and Medicaid, administrative provider appeals, and regulatory compliance plans for providers. And so, without further ado, I'm going to hand it over to our presenters, Richard Pecore and Gunnar Jurgensen.
Thank you, Liz. We're going to let Gunnar start off here. He's substituting in kindly for Leonard Schneider, who is one of our partners, and he's just been kind of inundated here at the end of the year. Gunnar's a qualified attorney. He has been working with us in the healthcare field, working on administrative appeals and things of that nature. He jumped right in. He's an honors graduate, very intelligent fella. We are very happy to have him with us. Gunnar, I'm going to let you launch into it and take it away, sir.
Hey, thank you for the kind words there, Richard. I appreciate it. And right back at you. Happy to be here. All right, so I'll just go over a brief, I guess I can do a quick disclaimer as well. So just off the bat, just to let everyone know, this presentation does not constitute legal advice. It's not meant to substitute for any qualified legal advice. The facts and circumstances of this particular case may vary greatly depending on your own unique circumstance that you would like to, there's something that comes up in this presentation that you would like to address with an attorney, then we recommend you do so, not just consult this presentation, although this can help provide some roadmap in how you have that discussion with said attorney. Just want to point that out from the jump. All right, so the presentation outline we can go over there is we're going to discuss the 2023 enforcement actions, not just those by the OIG, but also those taken up by the Department of Justice in their whatever capacity they can. We'll discuss that and how they're currently in sort of we could consider a transition phase of trying to obtain enough enforcers for their rules and regulations, while at the same time balancing that with increased Medicare and Medicaid funding. And we'll then discuss the 2024 overview and what to expect in the coming year. Much of this is going to be the same as we'll discuss in part 3 in the compendium. As we all know, there's a lot of slowdown during the COVID-19 pandemic, especially with federal agencies and their enforcement arms. And as a result, much of the compendium or the unimplemented recommendations has remained the same as the government agencies attempt to catch up based on what was done in 2020, 2021, 2022, now 2023, and going forward into 2024. So I'm not sure if any of the listeners here have participated in previous Reading the Tea Leaves webinars, but much of it will be the same. It'll be very similar, and that is a lot of it, again, is just because of the administrative backlog and these agencies attempting to catch up. And then we'll discuss state enforcement specifically and the Texas Office of the Inspector General and some of their focus areas. As we know, the states are different, have their own trajectories from the feds, and that's important to keep in mind, especially given that this is TAHCH and we are Texas-based home care providers. And then we'll discuss compliance essentials, risk and penalties, weighing cost and benefits, where the line is, where not to cross the line, and ways of reducing your risk of audits, investigations, some recent Supreme Court updates and cases on audits, investigations, and the expansion and enforcement of penalties for fraud and abuse practices, and other non-compliance issues. And Richard, I'm not sure if you wanted to hop in there and add anything else.
No, I think you're doing really well on that. That is a good synopsis of it. This is going to be repetitive in some areas, but there are some new things that we need to cover.
Stay on the lookout, listeners out there. All right, so enforcement actions in 2023, some common areas that were noted of common healthcare fraud schemes were billing for services not rendered. So that would be, billing for, pretty self-explanatory there, billing for a service that was not actually rendered, or there's no documentation supporting that those services were actually rendered. Excessive services, so just billing in excess of services where it might be repetitive, where there might be some coding guidelines that places a restraint on how often that service can be rendered within the same 3-month time period, and you're billing it, say, every month. Situations such as those, unbundling of services, upcoding of services, double billing, that kind of goes with excessive services as well. Kickbacks and government-sponsored programs. Again, those government-sponsored programs include Medicare, Medicaid, CHIP, so on. Spiked billing, identity theft, selling beneficiary patient lists, that's a big one. Billing for medically unnecessary services, false statements, telehealth, telemedicine schemes, and that's been huge since the COVID-19 pandemic and the transition to more remote-based platforms, which we'll discuss more in detail as we go on, is that is a area of strong OIG focus as of recent, as is sober homes and addiction treatment centers during the opioid crisis, an epidemic that we still find ourselves in, unfortunately. Durable medical equipment schemes reemergence, which can also coexist with telehealth and telemedicine, which we'll discuss. Lab fraud, specifically genetic testing, has been a major area, as well as allergy testing. COVID-19 related schemes, and compounding pharmacies. And a lot of those last bullet points, a lot of them overlap, as I briefly mentioned, where someone will be ordering telehealth services for durable medical equipment or some sort of lab testing, and at the same time, there'll be some sort of kickback for those ordered schemes on that online platform, and that's been a huge cost to both federal and state healthcare payers.
Hey, Gunnar, one of the things I wanted to add to that list, but it's a little crowded there, that I didn't get a chance to, is a new scheme called Churn and Burn that's going to affect folks in the hospice area. We're going to talk about that a little later.
Awesome. Thanks for pointing that one out. All right, so the OIG work plan, joint enforcement actions in 2023. The annual joint DOJ-OIG summer takedown for July 2023 included a COVID-19 national fraud enforcement action, which brought in, I want to say this is what, 2.5 billion in fraudulent billings that were noted through these investigations. There's Operation Nightingale. I'm not sure if any of our listeners have heard of that, but that involved a Florida-based nursing school that was essentially falsifying transcripts and other credentials for nursing students to then take the national nursing exam to then go on to provide nursing care to patients. And these were non-credentialed and non-authorized nursing services, essentially, because these were bogus credentials at the end of the day. And this resulted in 7,600 fake nursing diplomas, and resulted in 20 convictions. 25, I think, were charged. Then of those 25, 20 were actually convicted. There is also the telemedicine enforcement action in 2022, which again is more of the same from prior years, and also the opioid enforcement action in 2022, which is also the same from prior years. And again, that is largely due to the pandemic and just the backlog in the administrative apparatuses of the government as they try to catch up from that backlog. And obviously these problems are still prevalent, so there's an effort to keep addressing them moving forward in this past year and forthcoming years. Okay, now the OIG work plan for 2023. You can see we broke out the difference between fiscal year 2022, which spans from October 1st of 2021 to September 30th of 2022, and fiscal year 2023, same date range, just different years. In 2022, they expected to recover a total of $4 billion between audits and investigations, whereas in 2023, it's expected that they will take in about $3.4 billion in audits and investigations. But if we look a little closer at the numbers here in the breakdown, you can see that in fiscal year 2022, there was far more taken in from expected audit recoveries as opposed to in 2023, where there's only 200, I don't want to say only 283, but only 283.5 million in 2023, where there was over $1 billion in audit recoveries in fiscal year 2022. However, 2023 seemed to make up for that loss through investigative recoveries, and these are more for False Claims Act investigations and the like, where they're entering into settlement agreements with OIG or DOJ. And it looks like this is where a lot of the effort is going to be placed going forward, as you can see from past year, 2023, and going forward to 2024. It's not so much on audits. As we'll discuss, there's a lack of manpower for those audits, but there is a great opportunity for huge recoveries when it comes to investigative enforcement. All right, so budgeting is huge when it comes to the OIG's work plan. They are offering they received the largest sum of federal funds from any other administrative agency that federal government has, which is a lot of money. But at the same time, as we're increasing our expenditures on Medicare and Medicaid, the enforcement arm for Medicare and Medicaid has not kept pace. So 1 out of every 2,000 Medicare fee-for-service claims undergoes medical review by CMS. However, there's a 3-to-1 return on investment for those claims. So there's a lot of money slipping through the cracks there. There's a lot of fraud still taking place that OIG is more than well aware of, but at the same time, they don't necessarily have the manpower or the investment in their enforcement arms to clog up those holes and where money's seeping through. More money's going in, but at the same time, if you think of it as like a ship, more money's flooding in, but at the same time, they're not having enough money to plug the holes at the same time. And yeah, in 2022, that'll do. And just that the DOJ workforce lags behind potential enforcement caseloads, and FBI special agent staffing has been static during 2015 to 2022. That's been consistent. So again, there's just a lack of enforcement ability and a lot of for the OIG and the DOJ, despite more money going into the system. So every year, OIG publicizes its general and investigative work plan, thankfully, for the coming year, which lets us know exactly where their concerns are and where their efforts will be focused on. As we discussed, they don't have the funding they really need to address these concerns, so they have to have some salience in picking out exactly which areas they'd like to focus on. So it's nice that they do give us some instructive guidance as to areas to look out for, that they'll be on the prowl looking for fraud and abuse patterns and other areas where the Medicare Trust Fund is at risk. CMS and other HHS agencies, for the most part, implement all or most of the recommendations made by the Office of the Inspector General that is appointed to the Health and Human Services wing of the federal government. OIG's work plan includes monthly updates that are called unimplemented recommendations. These were formerly called compendiums, but now we just call them unimplemented recommendations. And these are just things to keep in mind that are likely coming down the pike, but just have not been implemented yet. And that's key, yet, because eventually they will be. And as we briefly touched on in the beginning, what was previously recommended, it has not been officially implemented, but is still on the agenda to be implemented as the government continues to get back on track following the COVID-19 pandemic and all the shutdowns that arose from that. These monthly updates include a top 25 unimplemented recommendations. So these are the 25 areas that, again, they'll plan on enforcing or focusing more of their efforts on reviewing and ensuring compliance for. These have included COVID-19 testing and treatment, home health services, cybersecurity, prescription drug cost, eligibility and program integrity, opioids and substance abuse disorders, and that includes sober homes, telehealth, other health technology, managed care, and value care programs, as well as improper billings and payments. All right. So here's the 2024 work plan and a general overview of the priorities for the OIG going forward into fiscal year 2024. Many of these, again, will seem familiar from years past, but they're still on the radar. So priority outcome number 1 is reducing the risk to beneficiaries for substance use disorder. So the OIG estimates that about 1 million Medicare beneficiaries are diagnosed with opioid use disorder on a yearly basis, yet less than 16% actually receive medication-assisted treatment for these drugs and to get them off these opioids. Obviously, opioids have a degree of importance, especially in a home health or hospice setting, depending on this patient's circumstance, but at the same time, there is the risk of these opioid substance abuse disorder results, and OIG has identified a shortfall between the care level needed for these 1 million beneficiaries estimated to have substance abuse and those who are actually receiving care for substance abuse. And obviously, substance abuse disorder can bleed into other areas of healthcare that can greatly affect these beneficiaries' outcomes, especially in a home health or hospice context. Priority outcome number 2 is to promote patient safety and accuracy of payments in home and community settings. Providers and state agencies did not always have to report potential incidents of abuse or neglect involving Medicaid beneficiaries with developmental disabilities. Some problem areas were Florida, Texas, Southern California, and the Midwest, with many homes fitting the characteristics of these abuse patterns not actually being identified or audited by state agencies who often did not have the resources. So OIG has focused some of its efforts at a federal level to ensuring that this no longer happens, at least to the extent that they possibly can. Again, yeah, state agencies did not report between 58 to 99% of these critical incidents, which is just galling and obviously explains why it's priority number 2, is to making sure that these are better addressed and better identified going forward. Priority outcome number 3 is to improve emergency preparedness and COVID-19 response and recovery. So as much as we like to think that we're out of the COVID-19 pandemic, still running wild. I know a lot of upper respiratory viruses are going around now, but especially in the nursing home context, and older Medicare beneficiaries are at heightened risk for complications related to COVID-19 and what they call now long COVID. And it's important to ensure that these nursing homes are abiding by certain regulatory standards and treatment standards to ensure their healthcare outcomes are increased, not decreased, as you would expect with COVID. There's been improvement, but again, we're still not at our goal. Outcome number 4 is to strengthen Medicaid and protect managed care from fraud and abuse and reduce improper payments. So hopefully no one's had to deal with them as of yet, but state Medicaid agencies, there are MFUCUs, as we call them. They are the Medicaid fraud control units, and the OIG has expanded those. They've added 3 new MFUCUs for a total of 20 across the countries. The new MFUCUs include North Dakota, Puerto Rico, and the U.S. Virgin Islands. They're also issuing guidance on statistical sampling in the MFUCU cases and opioid and drug diversion cases. So that statistical sampling is to essentially pick claims that they would like to review for fraud and abuse patterns, and to go from there, whether they'd like to extrapolate those claims from that statistical sample, or if they'd like to pull more claims based on the statistical sample, and that guidance is just really important to keep in mind for providers who do take Medicaid patients and Medicaid funding. That's very important to keep an eye out for, and it's important to know that there's a big emphasis on increasing surveillance of the Medicaid program itself. There has been evidence that Medicaid is a primary area of fraud and abuse, almost more so than Medicare now. And that's largely due to the lack of oversight and states not having the resources needed to complete the audits, complete their investigations. So OIG is making that a priority of their own to increase the accessibility of these state agencies and the auditing arms. Priority number 5 is to strengthen HHS's own cybersecurity protections for systems and data. HHS is the largest federal department, as we previously discussed, and it accounts for 23.2% of all federal expenditures and has a vast network of grantees, contractors, and service partners. It also carries a number of critical missions related to health and welfare of the United States. It also includes a ton of healthcare records of millions of Medicare beneficiaries located across the United States. With the increased prevalence of cybersecurity issues and attacks, there's been an increased emphasis on strengthening that infrastructure and strengthening that protection to best rebuke any attack, because a lot of important information that's held by the HHS, and to protect that at all costs is it's very important. There's been a ton of unresolved cybersecurity incidents, but which is why OIG, HHS is putting an emphasis on plugging that hole and making sure that going forward, these incidents are addressed or prevented in the first place. So just to briefly summarize the budget for HHS OIGs for fiscal year of 2024, the program integrity priorities for healthcare fraud abuse control, HCFAC. Is there an acronym we use for that, Richard? HCFAC, maybe?
I'm not sure if the internal word is HCFAC, but that's what we're going to say.
It'll do. All right, sounds good. So HCFAC. So there's increased Medicare fee-for-service medical review to identify improper payments. As we said, only one claim per 2,000 actually gets reviewed by Medicare, and they're trying to increase that number so that there's more parity between the two, making sure that they're catching fraudulent billing practices. There's an oversight of care provided in nursing home or home-based settings. Again, that goes to the issues that were identified with those with developmental disabilities and abuse patterns in those settings. Law enforcement prosecution of existing and emerging fraud schemes. These schemes are becoming increasingly more complex, so there's going to be an increased need to find ways to identify them and investigate them. There's investigations and forensic audits to identify fraud and abuse. There we go. That's a major focus for them, is finding more efficient ways to identify these schemes and prosecute them accordingly. There's increased specialized staffing for enforcement and oversight, and cutting edge data analytics to detect trends and outliers. And that's a lot of that will have to do with artificial intelligence and incorporating that into their algorithms and samplings of claims to identify fraudulent practices that do not fit within the norm. These algorithms and these artificial intelligence is, I guess we could call them, these robots, they're extremely good at identifying patterns. So to train those algorithms to identify an outlier in patterns that the human eye might not detect is going to be a big emphasis for OIG moving forward into the coming year. All right, so for part A, and then and I don't think this slide actually made it into this presentation, but I think it's important for us to highlight as well. It's the OIG's General Compliance Program Guidance. This came out on November 6th of 2023, and it offers a general update on the original program. But it's important, this might be the last one OIG ever does publish. OIG will no longer publish updated or new CPGs compliance program guidance. In the Federal Register, you'll have to actually check for these, I believe, on the OIG website, if I'm remembering that correctly, Richard, or are they just not publishing that at all?
Yeah, well, they're required, at least I thought they were required by federal law to publish it in the Federal Register, but apparently they don't feel the necessity. They're going to publish it online on their website. And I guess there's been a provision to allow them to do that as sort of a substitute site. It is published. It's just going to be online instead of in the same source everybody else goes to find their laws.
At least it's published, though. Something.
Yes,
I was already scheming some
they're still going
arguments.
to publish it, just not in the register. It'll be on their online website.
Awesome. And it's important to consult these because they deal with key federal authorities for entities to engage in healthcare business. The 7 elements of the compliance program, adaptations for small and large entities alike. There's different requirements depending on how large your entity is. The more resources you have, the more you're expected to comply with. The smaller you are, the less onerous the regulations. The less onerous your compliance actions are to be compared to a larger entity that has more resources at their disposal. There's other compliance considerations that you should keep in mind, including HIPAA-based compliance measures to make sure that you're protecting that PHI and OIG processes, how OIG processes their claim information and other resources the OIG would like to make available to healthcare providers. And then starting in 2024, OIG will be publishing an industry segment specific compliance program guidance. And this will be extremely helpful so you don't have to weed through the full litany of information. You can specify exactly what type of provider you are and look into areas where you need to increase your compliance and ways to comply efficiently. It'll be broken down into subsectors or ancillary sectors relating to the federal healthcare programs. These industry segment specific CPGs, ICBGs, will be tailored to fraud and abuse risk areas for each industry subsector and will address compliance measures that the industry subsector participants can take to reduce these risks. So the real goal, they want to make sure that you're just complying off the jump. They don't want to ensure compliance on the back end. They're trying to find efficient ways to give you the guidance you need to make sure that you're on the up and up with all of your compliance regulatory measures so that they don't have to come back and audit on the back end and result in greater cost and expense, both in the investigation and on the provider themselves having to pay back whatever sum of money is identified. So that's a great new resource they're offering to sort of get to the point quick. Those are the industry segment specific compliance guidance. All right, now back to the actual presentation we have at hand here. So Part A services, hospitals, and their work plan for specific areas. In November 2023, they issued a plan for identification of HHS cybersecurity vulnerabilities. They've also identified COVID-19 pandemic relief funding and the effects on nursing homes in select locations. There's been a huge uptick, I'm sure we've all heard, of COVID-19 fraud related to just a mass washing of money from that pandemic and from the federal government that has created a lot of opportunity for fraud. They've also introduced a work plan for the auditing of Medicaid applied behavioral analysis for children diagnosed with autism. We kind of briefly mentioned that before. And they've also introduced the potentially preventable hospitalizations of Medicare eligible skilled nursing facility residents. And this is just in hopes of engaging in preventative care to avoid costs down the line. And then for Part B services, home health agencies, and hospice services. Interestingly, as there's been an extra focus on telehealth, opioids, and cybersecurity, there have been fewer initiatives for the home health and hospice side of things. Again, we kind of mentioned it before, they're short on funding when it comes to ensuring compliance and conducting these audits and investigations. So where one area gets an increase of attention, that means another area is getting a decrease in attention. They can't really chew gum and walk at the same time. They have to pick one or the other. That's important to keep in mind. Doesn't mean that it's a free-for-all, but it means that they're likely to come back with greater emphasis in the coming years for home health and hospice agencies as they start to wind down their emphasis on telehealth, opioid treatments, and cybersecurity initiatives. And you can just briefly read some of those specific areas of specific initiatives they've initiated in the past from 2022 to 2023. You'll see a lot of similarities between the two again as the government continues on that trend to address its backlog of unaddressed initiatives. And I think Richard is going to take it away from here unless he had something to add to that beginning set of slides there that I discussed.
Well, if you
in enough detail, there's a lot there. So
yeah, I appreciate it, Gunnar. What we got here is if you look up there at the link, the work plan updates, there are literally hundreds of these studies that get done and added to, and they're trying to catch up on the backlog of all these they've had over the past 2 years. And these are just a sampling of some of the topics that have been added. If you want to get into this in more depth, you can always go to the link and you can sort through these Excel sheets like I did. But I think you'll find this is just giving you an idea that they're still doing the studies. They're still focusing on each area. They're still adding things as they can get to it. But there's also some enforcement aspects that have gone on in some of these. And for home health, since we're talking with TAHCH, I wanted to add a couple that have happened this past year. In November of 2023, law enforcement in New Orleans convicted a hospice owner for overbilling Medicare more than $600 a patient per day between 2013 and 2019. He billed Medicare $62 million, was paid about $47 million. The owner manipulated, in particular, CPT codes 99236 for observation, he was upcoding it, or billing ineligible hospice patients, and CPT code 99233, which is a level 3 follow-up note to a hospital, which is the highest level, and that's unbillable in a hospice setting. So that's an example of a fraud that's been going on that they got the owner for. And in October, the month before in South Florida, the lead defendant in the South Florida Home Health Agency fraud scheme was sentenced to 8 years and over $8 million in restitution for billing the Blue Cross Blue Shield more than $36 million in physical therapy services for 2018 to 2023 that the patients never received. The co-conspirators paid kickbacks to beneficiaries for filing false claims at 30 different clinics and paid kickbacks to co-conspirators for patient referrals. That's how this got on the Fed's radar. But this is important because this is a private payer, Blue Cross Blue Shield. But when they did the kickbacks, they crossed into the line that was going to draw a lot of unwanted attention. So that's just an example. And the churn and burn I wanted to mention, that's the fraud trend that it's been countered in the southwestern U.S. states, particularly California, Nevada, Arizona, and Texas. It's a pilot program that CMS has instituted for enhanced oversight of new hospices. The idea here is that the hospices will open up a new facility or a new number, and they'll bring in patients and they'll overbill. And then before they get caught, they will shut it all down. They'll buy a new number, transfer their patients to that, and start all over again. So that is something that has started in these 4 states, but we do expect it to be expanded. So I think you're going to be seeing more of this. Let's go to the next slide here. Okay, skilled nursing facilities and nursing homes. I've got something on that one too, I think. Oh, I wanted to mention telehealth, which was a slide before, I think. Can we skip back one? The most important thing that came out in telehealth was the OIG toolkit for analyzing telehealth claims. That's something that OIG published. If you're involved with telehealth, either from the billing aspect or from providers or you're with a provider that does a lot of that, then you need to take a look at that, because it's a good way to improve your claims and make sure that you're including everything you need to keep it from getting kicked back. In October 2022, one of the topics that was added for study was Medicare telehealth services during COVID-19, telehealth services in select federal healthcare programs, and use of telehealth in June back in 2021 to provide behavioral health services in Medicaid managed care. Go to the skilled nursing facilities on the next slide. In November 2023, a California SNF owner and management company agreed to a $45.6 million consent judgment to settle allegations of kickbacks paid to referring physicians in violation of the anti-kickback statute. Now, the SNF medical directorship agreements were being systematically used to pay kickbacks to physicians as inducement for patient referrals to 6 SNF facilities that were owned by this particular person. That's another example of some of the law enforcement that continues to take place. Then you've got some more of the topics from the work plan that came in, new studies, audit of nursing homes, emergency power systems. In May, the nursing home facility initiated discharges. A data brief was concocted. That one's been revised, a new date, so that means it's continuing. February 2023, an in-depth review of nursing home citations related to the use of antipsychotic drugs. And from November of last year, 2022 performance data for the senior Medicare patrol projects. Next slide, please. Laboratories outside of COVID-related fraud, there weren't any new ones in the last half of 2022. There are a couple in 2023. There's probably a few more, but basically in October, Medicare Part B payments for lab services were going to be studied, and trend analysis of Medicare laboratory billing for potential fraud and abuse with COVID-19 add-on testing came out in September. The COVID scams continue. They started off when this thing broke, and they haven't let up. They're still there. You don't have the cycling of the testing that was going on during the heyday, but you still have the aftermath, and you still have scams that continue. The fraud scheme down here that was emerging down here at that time at the bottom of the page was the genetic testing. That's no longer emerging. I mean, it's established, but they're going to continue looking at that. It's just spending payments and billers for laboratories that continue to work on that particular fraud scheme. Next slide, please. We are going to save a little time here. I'm not going to focus on all these because the compendium is the same as last year, which is the same as the year before. It didn't change. They weren't able to get all of them, so they're just keeping it the same. In fact, the 2022 compendium is the last one that's been published. So you see protecting patients in items 1 and 2, Medicare Parts A and B. CMS should take steps to tie Medicare hospice payments to beneficiary care needs. Quality of care services should be adequate to serve beneficiaries' needs. It's the same sort of thing that you see over and over in the Excel spreadsheets and the work plans. They're all good ideas that haven't been gotten to yet or maybe in the works. So I'm going to let y'all read these 2 pages here on these. We can skip to the next page because what we're looking at is they have these different initiatives for all the different parts of Medicare and then in generally. And some are going to be looking at specific areas like number 9, they're going to be looking at medicated assisted drug treatment, Noxalone, for drug overdoses of opioids, things like that. And they're important, but it's taken a long time to get to these. So as we go through the compendium items, you'll have the opportunity when you see the PowerPoint to look at all of these. And if you want to give it a little more in-depth study, you can. But basically, they're looking to improve managed care. They're looking to report Medicaid data better. They're looking to develop policies and procedures to improve timeliness and recover uncollected amounts identified by audits. It's the sort of common sense stuff that you'd be expecting them to do over the course of time. And of course, you have some initiatives that were not set up by CMS. National Institute of Health has one there. FDA has one. General departmental goals. They'll take the suggestions from anywhere and they incorporate it from many different agencies. But the majority, the vast majority, is HHS and CMS when they get down to doing these and OIG. Next slide, please. This is the stuff that I want to get into and talk about. The state enforcement, if you're not aware, state enforcement, the MFUCUs, the law enforcement aspect on the state level is just as important because it involves all the Medicaid. What can you look for if you're looking at, where's the heat going to come from? Texas publishes quarterly reports after the fallout of the HHSC scams from the OIG Commission when they had kickbacks and favoritisms and contracts and things like that. That was uncovered. Then they had a big cleanup operation that lasted a couple of years. Since that time, they now publish quarterly reports on the goals, results, investigations, where the money went, what they've done with it, what's happened as a result of the investigation. So if you see here, the most recent data from the fourth quarter shows that they have identified for recovery, which means over and under payments, almost $300 million. And of course, the top source for that are providers and MCOs. That's almost 93%. Cost avoidance, which is not having to pay out claims that they otherwise would have if they'd been proper. It's 46 million. Of course, providers and MCOs account for 40 million of that, which is 87%. And the benefit program integrity program, they have collected over 12 million in overpayments. That's just the fourth quarter. They closed 88% of the open cases, which is a pretty good clip. And they also referred out 14 cases to criminal prosecution. Now, you look at the percentage there is 0.003%. That should tell you something. What it tells you is that unless you're really doing something wrong, the chances of a program integrity audit of some kind turning into a criminal prosecution are not real big. Now, that doesn't mean that you might not suddenly have a bunch of sheriffs showing up at your door coming in if they're investigating somebody that you've done business with in the past, and they might be seizing records or something, because I've seen that happen. But it does mean that you're probably not going to stay caught up in the net, even if you get kind of swooped up in the process. So it's good news from that perspective. If you take a look, the preliminary provider investigations and the full-scale provider investigations on the left and the right, you see where home health agencies fall in the course of this. Now, for whatever reason, they didn't list hospices, so I don't have any data on that. But it does give you an idea that y'all are pretty close to the top when it comes to getting these investigations from OIG. So it behooves you to employ that compliance plan and try to keep it up to snuff and use it as a tool to stay ahead of the curve, to keep your compliance up to date, to keep your people trained, to keep your documentation accurate, to document medical necessity fully, to do things like that, and to make sure that you document the homebound aspect And if there's any face-to-face examinations or documentation you need from your doctors and your doctors have been lacking, you need to try to get with them and talk with them about arranging a time, a schedule, something where you can get your paperwork back from them on a regular basis when they're available, when they're sitting down and they're signing all this stuff, because they tend to do it when they have, either when they have a chance, or they like to try to do it at a scheduled time when they can just sign a whole bunch of it and then send it off. So let's take a look at the next slide here. Keep that in mind as we're going through this. Let's talk about one of the other enforcement aspects, which is what's happened in the world of overpayment appeals. Because if you get the call and you get an audit, or you get a contractor letter and you have to produce these, you still got to defend it. Well, has it gotten any better? On the surface, I got to say, yeah. We have seen an improvement where the percentage of favorable rulings have increased. And you can see there that's been true for both Part A, Part B, and DME. At the redetermination level, this is data from last year. But you still see both for DMEs and redeterminations of Part A, unfavorable is still the majority of the claims. Let's take a look at the next slide here. And if, before we go, if you look there, the highest percentage is E&M claims, the evaluation management services. And you take a look at hospice and home health, sorry. We go back one. We go back one slide to 23. Thank you. Hospice and home health, they're around about 6% of it. Can everyone hear me okay? I want to make sure that my computer's give me a signal that it can't hear me. So I'm going to move this.
You're good. You're loud and clear.
Okay. Let's go to the next slide here and take a peek at the reconsideration level 2. And you see again, in this case, there's a lot less good news. The unfavorable rulings are still the vast majority of the rulings, although, again, there is improvement. And again, hospice and home health fall in the middle of the pack there, 9% and 6% of the decided claims. And this is for appeals in general when you have a whole block done in an audit. Next slide, please. And then we get to the ringer, the ALJ data. The good news is the backlog from the last 10 years is over. At the ALJ level, at least, it's been eliminated. And you can see the data there where it just started jumping at an exponential rate between 2013 and 2022. It took a long time for that to come down, and they hired a lot of new judges. And the problem is they're inexperienced. A lot of them, this may be their first job right out of law school. Who knows? You have now a change in tactics where a lot of the data, and we're going to talk about the table in a second, has resulted in things being kicked upstairs. The MAC is appealing every successful extrapolation. This has been our experience, and almost every one is overturned. They just keep going. They can do that. They're the government. When you're talking about level 4, they can take it to level 4. I was involved in a $6 million case several years ago that went to level 5, U.S. District Court level, and the government just kept going until they won. Put the guy out of business. That's what happens. So if they get a burr in their saddle, there's no telling what can happen. We also found that large favorable overpayment rulings are also being appealed by OMHA, and quite a few of those also get overturned. So basically the backlogs moved upstairs. It went from the ALJ level to now it's at the MAC level. The second MAC level, the one above them. And let's take a better look at the data here. When you see at the top table there, for appeals generally. These are where you have a block of claims. In 2014, the success rate was about 36%. You see it's improved. It's come up around 28, 29 here the last couple of years. But if you look down at the unfavorable and the dismissed, what's happened is all the cases in between, look at the rates there. It got up to 60%, almost 61 in 2018. They were kicking the cases out on appeal, finding something wrong with them so they didn't have to deal with the backlog. So you weren't getting your appeal heard. And what's happened is it's decreased. So the number of cases they're kicking out has decreased, but the number of unfavorable rulings has gone through the roof. It's increased by 20%. So while the favorable rulings have increased some, so has the likelihood that you're going to get an unfavorable ruling rather than have it dismissed. Same thing with the individual claims. You see the success rate on the individual level is nowhere near what it was in 2014. It's about half. From 28%, it's only around 12 and a half right now. Same thing happened on the individual claim level where dismissals were lower. Kind of flipped around last year, but this year it's about the same as far as dismissals, but the unfavorable rulings have increased. So, you know, it's when is good news not good news? It's still a fight. You still have to defend your claims. You still have to be prepared with a war chest. And if any of you out there listening have not taken that to heart, I urge you, please, please set up a war chest for when you have an appeal. It's not a question of if, it's a question of when. It's like sleeping with a rattlesnake. It's not whether it's going to bite you, it's when. That's the government. You're sleeping with a rattlesnake. It's the nature of the snake. Can't help itself. So be prepared. Just assume that you're going to get that letter. You're going to get that audit. You're going to have that investigator walk in the door and hand you a letter and say, I need to see your records. It's going to happen. So have some money set aside so you can contact an attorney, so you can get somebody on board, and you make that call immediately after you established who they are with their ID. And then, you know, once you know that, make a call to your attorney. And if there's a subpoena involved, especially call your attorney. Next slide, please. What steps can you take to respond, to avoid a response when on a prepare? Use your work plan. It's not just a toy. It's not there to sit on the shelf. It's something that can really help you. Understand the Affordable Care Act's federal requirements. The Secretary of HHS can mandate that all participating providers and suppliers have an effective compliance program, and they have. So now you're required to have it, but now they're starting to issue the individual guidance, so it's become even more important. The federal compliance plan requirements are being enforced now. We already know that. It's your single best defense. Because one of the things they're starting to ask now is when you get audited, why didn't you have a plan in place to deal with that? They're going to ask you. And remember your state requirements. You're going to have to swear, if you're in the state of Texas, that you have an effective program in place when you re-up your application. You have to certify it. So if you don't, and you certify, you just lied to the state, and you have a whole nother bundle of problems. Next slide, please. HHS final rule, AKS and Stark revisions. They're there for you to read. Exception for telehealth. This is from last year. And again, there's the citations and the links if you want to take a look at those two. They're back from 2020. Next slide. Well, the Supreme Court update, these are a couple of years old now. Roe versus Wade was overturned. We know that. Dobson v. Jackson was a companion case. But basically, the question remains, what now constitutes permissible reasons for ending pregnancies in various states? And it keeps changing. And they still haven't sorted it out. So this is still something that's up in the air. Next slide, please. Also remember that the reasons for revocation have been expanded. And this is also from 2019. So you should be familiar with these by now. They were on there last year when we went through this. The blue reasons are the newer ones that were added. And you see that prescribing authority, improper prescribing practices, debt referred to the U.S. Treasury, revoked under a different name, affiliation that poses an undue risk. That's something that they're starting to put into play. Billing from a non-compliant location, or abusive ordering, certifying, referring, or prescribing for Part A or B services. Next slide. And expansion of the enrollment, re-enrollment denial reasons. Of course, the blue ones there are the new ones. They're revoked under a different name, numerical identifier, business identity is not expired, affiliation that poses undue risk, other program termination or suspension. There's a couple new ones that have been added, false claims judgments, civil judgment under the FCA, not a settlement, but a judgment can get your enrollment denied. Also, all practice location changes now have to be reported within 30 days, not 90. That's a big change, and y'all need to be aware of it. Do we have any questions, Grace, that we need to address before we go?
Let's see. It does look like there was no questions.
Okay, the last slide I think is the question slide. So.
Okay, let's go to the next slide.
And it has our contact information there. So if you'd like to, if you think of any questions later and you want to catch up with us, you can catch up at that number. You can get to Gunner through the switchboard, our main number, 202-298-8750 in Washington, D.C. We have phones on our desk that they can send the call directly to us. So isn't technology wonderful? Grace, thank you very much for allowing us to come in and speak with your members again. We enjoy doing this. We really appreciate your participation, and we wish you all the best. Have a great day.
Thank you, everyone.